Thanks for joining Health Affairs this week. I'm Vabren Watts.
And I'm Ryann Tanap.
You will be hearing from us throughout the year, with the podcast episodes focused on health equity.
Yeah, that's right, Vabe. And I think it'd be great to start off this podcast just kind of reflecting on some of the recent and upcoming cultural observances.
Oh, yes, April was a month.
Yes, April is Arab American Heritage Month. So we're wrapping up that month. And just for some context, there are about 4 million Americans that have Arab roots in the U.S. That means people of descent from the Middle East and North African countries. And I also want to point out that April 21st, last Friday, was the end of Ramadan, otherwise called Eid al-Fitr. And for those who aren't aware, Ramadan is observed by Muslims around the world, and they fast from dawn to sunset during this month. And then at sundown, that's when they break their fast with what's called iftar. So just some fun facts there, something to note about April.
You know, MENA, which means Middle Eastern, Northern Africa, has really been in the news lately, especially as it relates to around like collecting data, demographics around like the next, 2030 census. The federal government is actually thinking about adding MENA to a separate category other than white, actually having their own category listed as race. And Ryan, for this month, actually, there was a deadline to provide thoughts on a proposal to change race and ethnicity, particularly as it relates to MENA, as well as another race and ethnicity, changing Hispanic from an ethnicity to race. That could really have a major shift in the demographics.
Right. And like currently, Middle Eastern, North African, like of those descents, like you have to categorize yourself as white because
Yes. Mm-hmm.
there is no category for you. So I think that'll really help with like disaggregating data, which will eventually, impact health policy and, the communities that are served. So that's a great thing to point out.
Yes, and I think the last time they really did this shift was, I know, because I've been big on. You heard me talk a lot about like data and things along those lines. I think the last time that happened, it was actually separating Asian American and Native Hawaiian and Pacific Islander, which happened sometime, I guess, at the turn of the century. Within the early 2000s, and now those are two separate races on the census. And I know this is timely because in May we have another Cultural
Yes.
Observance Month coming up.
That's correct. May is Asian American, Native Hawaiian, and Pacific Islander Heritage Month. A lot of words there, big acronym, but just some history about the month. So there are 24 million people of Asian descent and 1.7 million people of Native Hawaiian or Pacific Islander descent in the US. And it actually started off as an observance for 1 week, and it was called the Asian Pacific American Heritage Week. Congress created it in 1978, and it coincides with the arrival of the first Japanese immigrants in 1843, May of that year, and Chinese workers and their role in building the Transcontinental Railroad, which was completed in May 1869. So another key fact about Asian American history there. And also, this is not as well known, but Filipinos and other Asian ethnicities were actually first recorded or first documented to arrive in the U.S. in the 16th century. A lot of them were slaves or prisoners on ships sailing from New Spain or Mexico, due to Spanish colonization. So now it's observed over the period of a month, and Congress expanded that in 1992. So yeah, it's really exciting.
You know what? That is exciting. I would say, by the time 1992 came around, I was in school, uh, probably elementary, middle school, somewhere around that age. And as I think about it, there really wasn't that much history around Asian Americans or Native Hawaiians or Pacific Islanders when I was in school. And I wonder, if it's even, the same, like that now. We really do not get that exposure.
Right. I mean, it wasn't in when I was in school either. Maybe in college there were some courses that you could take depending on, the school that you're at, but there wasn't an Asian American Native Hawaiian Pacific Islander like class when I
Right.
was in college,
Right.
which is fascinating. And it's
So,
frustrating that, I didn't get to learn about, my own cultural heritage until like doing my own research and like beyond college.
so like knowing that, Ryan, you oversee like health equity education. And one of that is really, making sure that these voices are elevated. And we called it elevated voices. And this, Ryan, this was before you were here. It's just elevating those voices that have been like silent, and like those different cultures that have been silent or may have been left out of the conversation. So what are we doing this month?
In honor of May, Asian American, Native Hawaiian, and Pacific Islander Heritage Month, we're doing a campaign on social media and also on our Health Affairs Today newsletter. Definitely subscribe to that. We'll be elevating voices and organizations who've made an impact on health policy and equity, specifically pertaining to this particular population, Asian Americans, Native Hawaiians, Pacific Islanders. So keep an eye out for that. That will feature some of our authors from their publications in health affairs and other organizations. Something I'm looking forward to, at least for this month.
We also plan to highlight some books for people to learn more about Asian American, Native Hawaiian, Pacific Islanders. In one book, I know you and I talked about this, and it was by Ronald Takaki. The book was written somewhere between, I would say, 1995 and the early 2000s. But this book taught me so much about the Asian American experience within this country, and it's called Strangers from a Different Shore, where it really talks about like Angel Island, which was the Ellis Island of the West when Asian American immigrants came over to the country, to this country a long time ago. As well as, I know you recommended some books by Erica Lee called The Making of Asian America, and then also George Takei with his book They Called Us Enemy.
Yep, those are some really great reads. Learning about the Asian American, Pacific Islander, Native Hawaiian diaspora. There's one more that I wanted to bring up. So there's actually a book called Hawaii's Story by Queen Liliuokalani, and she was actually the last monarch of Hawaii. In her book, she talks about how American and European businessmen forced her to abdicate the throne, and then eventually, Hawaii becoming a state, US, the 50th state of the United States. So, really interesting read there. Definitely check it out to dig more into this in observation of this month. So, going into more of what we've been up to, kind of circling back to that, our team is really, focused on showcasing and advancing equity and highlighting health equity. So, I know that you've been up to quite a lot the past month, Vabe. What conferences have you been visiting?
So I've been to a couple of conferences. I first took a trip to Harvard to actually provide a review of a paper that they published on the impact of like, anti-racist change within hospital systems. I mean, it was great. We'll provide a link for you on that, but basically, it is about like three hospitals that have actually taken a step to actually do anti-racism change prior to the pandemic. They wanted to make sure it was prior to the pandemic so they can see like overall like from inception to implementation to like the results that they found. And one of the things that actually stuck out was that when it came to metrics, the metrics of like all three of those hospitals when it came to advancing equity sort of dropped off a little bit. They didn't do like really the evaluations, but it is really a great paper that was written by Angel Rodriguez. And so, like I said, really look at the show notes and we'll provide that link to that report on there. Also, I was at the National Minority Quality Forum, which was a great conference. And you know what, Ryan? You know what subject came up a lot?
What's that?
Actually, it was like race and ethnicity categorizations. I mean, this is like really a hot topic right now. And so we are, reports. I think the reports over the past 10 years is have been saying that the United States will probably be what they say the phrase the majority minority country come 2050, but it looks like now as people are talking that will be sooner than then. And so like they were talking about gather data gathering, how it can really inform how a specific population is doing, and it needs to be done at all levels, including the federal level, like the Census Bureau and things along those lines. And also, Blue Cross Blue Shield is doing a big push for payers to collect data on race, ethnicity, and gender, and things along those lines. One of the speakers who was speaking at that session said, it's important that we collect this, but he said you just can't data your way out of racism. You must also educate people on why it is important. So that's something that we're trying to do at Health Affairs. Like we have these programs, but then we have you to come along and be like, hey, this is why this is important. And then I took a trip to St. Louis. I was at Washington University, which is a beautiful campus, by the way. This was my first time in St. Louis, and it was actually a conference on advancing equity and scholarly publishing, and it included other journals who are really dedicated to really advancing health equity. And so, and so we're really trying to, advance equity. Going to these conferences is amazing. One of the things that I did like about going to these conferences, actually, that everyone is about fellowship programs, and those fellowship programs include like how are we building up the next generation of like scholars in particular areas, and like and in particular scholars who belong to historically marginalized groups such as women, such as people of color. And so it that this was a very important topic that was like mentioned all throughout that conference with the other journals. And it just made me think that, hey, we have a fellowship program that is going on now, which started in 2022. And I am proud to say that we have our first fellow um, actually to publish a paper from that first cohort. And that is Andrew Anderson, who has a paper coming out in the May issue of Health Affairs. So you really have to keep an eye out for Dr. Andrew Anderson's paper. Not only that, he is also doing a forefront article, and he is a guest on health and on a health policy episode that you all need to subscribe to, and also a guest on one of our lunch and learns, which is talking about how we've been advancing equity at Health Affairs over the past couple of years.
That's great. Yeah, I'm super excited for Andrew's all of his content coming out in May. I'm really excited to also like celebrate and elevate his work as he's the first fellow that we have, publishing a paper with Health Affairs. And that's great. I mean, we just started the fellowship last year, so clearly we're making a change. Well, I guess we could wrap up here. Thank you so much for listening to another episode of Health Affairs this week. If you like the podcast, please tell a friend, leave a review, or subscribe wherever you listen to your podcasts.
I'm Vabren Watts.
And I'm Ryann Tanap.
Goodbye.
Bye.